హలో స్వాతి, మీ ఆడియో కనెక్ట్ అవ్వలేదు, చూసుకోండి. హాయ్ స్వాతి, హాయ్ స్వరూప్, వినిపిస్తుందా? హలో స్వరూప్, స్వాతి.
yes వెనిలా
యా, నా ఆడియో క్లియర్ ఉందా స్వరూప్?
చాలా క్లియర్ ఉంది.
మీది కొంచెం ఎందుకో లాంగ్ డిస్టెన్స్ నుంచి మాట్లాడుతున్నట్టుంది, ఒక్కసారి చూసుకోరా.
చేస్తాను, నేను స్పీకర్స్ కనెక్ట్ చేసుకుంటున్నా.
ఓకే దెన్, యా రైట్. స్వాతి, స్వాతి
హలో
హలో,
వినిపిస్తుందా అండి?
రమేష్ గారు.
నేనే.
యా వినిపిస్తుంది, కానీ కొంచెం దూరంగా ఉంది, వాయిస్ చిన్నగా ఉంది. వాయిస్ తో పెద్ద అవసరం లేదు, జస్ట్ ఆ పీపీటీస్ లోడ్ చేసుకొని పెట్టుకోమనండి. స్వాతికి ఆల్రెడీ చెప్పేశాను నేను. యా ఓకే, థ్యాంక్ యూ సో మచ్. మీ పాస్ అడిగారుగా, ఇచ్చి పంపించాను, శ్రీకాంత్ తీసుకోండి.
ఇచ్చాడండి, థ్యాంక్ యూ.
ఓకే రైట్, బాయ్.
వెనీలా నా ఆడియో ఒకసారి చెక్ చేస్తావా?
వెరీ క్లియర్. ఇందాకటి మీద కంపేర్ చేస్తే చాలా క్లియర్.
క్రియేటివ్ స్పీకర్స్ ఎఫెక్ట్. ఓకే బాయ్.
ఓకే సార్. నేను మిమ్మల్ని కోహోస్ట్ చేశాను. సో కోహోస్ట్ అంటే ఏం చేశారంటే యూ కెన్ మూవ్ ఇన్ డిఫరెంట్ రూమ్స్. అంటే డాక్టర్స్ కి నర్సెస్ కి వాళ్ళ సెపరేట్ సెషన్స్ కదా. సో యూ విల్ బి ఇన్ టు నర్సెస్ రూమ్. బట్ ఎనీ టైమ్ ఇఫ్ యూ వాంట్ టు కమ్ బ్యాక్ టు డాక్టర్స్ రూమ్ యూ కెన్. బట్ మోస్ట్ ఆఫ్ ద టైమ్ మీరు టెరీ రూమ్ లోనే ఉంటారు. ఓకేనా?
ఓకే ఓకే
ఓకే. నేను మిమ్మల్ని మూవ్ చేస్తాను నర్సెస్ రూమ్ లోకి బ్రేక్అవుట్ స్టార్ట్ అయ్యాక.
సరే సరే ఓకే.
Hello, Vinila.
Hi, ma'am.
Can I try screen sharing?
Yes, ma'am, you can. I'll stop my share.
Thank you. I'll practice. What's happening? I need to see. You can see, no? Can you see my screen?
I can see. Yeah, I can see.
Okay, thanks.
Very good afternoon, one and all. I see there are about 24 participants, like excluding us, I see only like 18 of you who have joined for the session. So we'll just wait. It's exactly 3 o'clock. We'll just wait for a minute or two and then start our actual introductory session. Hope it's all right with you all.
Okay. Yeah, okay, sure.
Thank you. It's a small announcement to all of you. I still see some participants joining with Galaxy M31, Oppo, and Samsung. So I request all of you to please rename yourself. Otherwise, it's very difficult to track the attendance. Kindly kindly rename yourself. Bottom of your screen, you can see an icon called participants. When you click that, you can see your name. Just right click and just rename yourself. Or if you can't do that, just type your name in the chat and we'll do it for you. It's already like 3 minutes past 3. So I think we should start now. Once again, good afternoon, everyone. There's some problem with my camera, so sorry about that. I'll try to fix it in a while. Once again, good afternoon. My name is Vinila. As you all know, I'm the program coordinator and the course coordinator for this 6 weeks palliative care course, certificate course in pain and palliative care. And I would like to introduce 2 faculty members. And before that, I would like to tell you about some Zoom etiquette. Please turn on your cameras and please turn them on throughout the sessions, and turning off the camera for a minute or 2 or maybe for 5 minutes is acceptable. Otherwise, it's very difficult and we need lot of interaction from you. And first point, please rename yourself. So I still see, I think, yeah, most of you have done it. Thank you so much. Please go to participants and rename yourself. Otherwise, it's difficult to track the attendance. And then if you have any question, please raise your hand and please feel free to ask. And if you're not able to ask the question, please always type your question in the chat box and one of us will read out the question for the faculty. So with this, we will start our session. And we have 2 great faculty here. And today we are going to have 2 we have a faculty for the doctors and we have a faculty for nurses. So I hereby would like to introduce Dr. Gayatri Palat. So as you all know, you have met Dr. Gayatri Palat during our introductory session and also during the last session, during introduction to communication session. So Dr. Gayatri Palat is the head and consultant in Department of Pain and Palliative Medicine at MNJ Cancer Hospital, Hyderabad. And Madam is also the managing trustee for this Hyderabad Center for Palliative Care, which in collaboration with Jewels Cancer Collaboration and University of Jaffna, Northern Province, we are doing this course. And I also have the senior faculty, nurse faculty. He's Mr. Terry. I'm sorry. So we have the nurse faculty with us here. He is Mr. Terry. It gives like pleasure to introducing him. He's Mr. Terry Mice. He's basically a nurse practitioner and he's one of the nursing faculty and research associate in Institute of Palliative Medicine in Kozhikode, Kerala. And he's one of the national faculty members at Indian Association of Palliative Care. And he's also the faculty member of Impact Healthcare. So welcome, Terry. And I also have another senior nurse faculty with us today who is going to be one of the facilitators for our session. He is Mr. Swarup Immaraju. I think Swarup Immaraju, Swarup, can we all see you once? Yeah, Mr. Swarup Immaraju is one of the senior most nurses working with our palliative care program in Hyderabad. And he has more than 15 years of experience in palliative care working with our program. And he has been one of the senior most faculty for nurses for almost like 60 to 70 courses which have been conducted so far. Welcome Swarup, welcome Dr. Gayatri Palat and welcome Mr. Terry, and over to you.
Thank you very much, Vanilla, for the kind introduction. And I think we quickly will break ourselves into two groups, doctors group and nurses group.
I'm going to do that now.
Parallel stream and then start our respective session.
Yes, I'm breaking out. Already doctors and nurses have been assigned rooms. So I'm going to do that. And I requested Shweta to help me with that. Shweta, can you just please help me with that?
Sure, ma'am. There would be an breakout room option on your screen. So you can just start.
I'm here. So just after 1 minute. Yes.
Hello. Hello.
Yes, ma'am.
Yeah. So
Ma'am, it's taking time. Like it's in progress. Just
Shweta, let us know when done.
Yes, ma'am. It's almost done. Just a minute.
yes. Okay, ma'am.
Hi Shweta, it says like you are not joined. So
Ma'am, actually, this is the main room. So once all the participants have been assigned to their breakout Zoom, the ones who are the co-host, that is the faculty members and everyone, would remain in the main room. Then we can switch to the respective rooms. The faculty members can switch to the respective rooms
okay,
once
but
it's all done.
my concern is like I have there are still 17 members who have not been assigned any group. So how do we go about that?
Just give me a minute, ma'am. I'll assign them. I do have the list with me.
Yes, please.
Just give
Can
me.
you just make it fast?
Yes, sure. Vanilla ma'am.
Yes, Shweta.
Ma'am, you can see like there is one participant. I couldn't find the name. Just a minute. There is Galaxy A10s. I'm not sure the name of that participant. So, I mean, if that person could tell
just
me.
put him in the nurses group, no, please.
Okay, sure.
Hello, excuse me.
Yes, please.
I am nursing staff.
Okay. Just give me a minute. Ma'am, it's done. Like all have been assigned to their rooms.
Thank you so much, Shweta.
You're welcome, ma'am. Vanilla, ma'am, are you there?
Yes, Shweta, I'm here. I'm going to nurses room now.
Ma'am, actually, can you make Prateek Negi from Echo India the co-host? As I told.
Yeah, I'm going to do that. Yes, have done it.
Okay, thank you so much, ma'am. Thank you.
Yeah, okay.
And Kulanday, where are you working? Which organization you are working with?
DGH Klinoch.
Okay, this is
Working
it's a,
station Klinoch.
okay. This is like most of you are working in palliative care centers or medical college or secondary care hospital or primary health centers. What is anyone working in a medical college setup? You can just unmute and tell me. Is anyone working in an exclusive palliative care center? Okay. And Kamalaveni ma'am, where are you working?
District General Hospital, Mullathil, working
Okay.
at operating theatre.
Okay. That's nice. Oh, that's why you're in scrubs. Okay. Vinila ma'am, are you here?
Sorry, Terry. Terry, sorry. She just called me telling that you shared my PPT. So anyway, I'll be sharing that with you. Just to.
Yes, Swaroop, please go ahead. I think, I don't know, like for some reason, all of a sudden my system got fluctuating. So sorry about that. Can you just please help me with sharing the screen? Sorry, Terry. I'll just see what happened exactly.
Okay.
Thank you. Thank you so much, Terry, for giving your time.
No problem, ma'am. Ma'am, if it is a difficulty, I will start sharing from my side. If my internet goes down, you can take over sharing.
Yes.
Is that okay?
Yes.
Yeah, Terry. Even I'm ready with that. So if you have that opportunity, you can just go forward with that. I'll be there in backup for you.
The only problem, my audio gets cut if I start sharing. I'm not in the institute. I'm at home. The internet is not very good here. Anyway, I'll start the presentation. Let's see how it goes, and if needed, let's change. Okay.
Yeah, that's fine. Go ahead.
Yeah. Okay. Good afternoon, everyone, and thank you, Neela ma'am and Swaroop, for this opportunity to discuss the topics with you. Today, we will be talking about one of the basic problems that we commonly see in a palliative care setup. That is pain. We will be dealing with this topic as two different sessions. So today is the first session on the topic of pain. We will only be talking about introduction, pathophysiology, and assessment. I know when we talk about pain, when we stop at when we only talk about introduction, pathophysiology, and then finish with assessment, we are kind of leaving it in a cliffhanger. You know, the main part of pain management comes much later. But probably we may have to wait. And I will give you some reading materials to review these things so that you familiarize with certain concepts that we have to learn in the management and in the study of pain. Okay. I would really ask you to, if possible, turn on your videos and if you can, really contribute to the discussion, it will be very good. I don't like to speak one way lectures. It will be good if you can give me some answers so that we can build on certain important concepts and understand further. So to start with, can somebody say what pain is? What is pain? What is pain? Can somebody just unmute and tell what you think about pain? Anything that comes to your mind when you hear the word pain? If nobody is unmuting, I may probably have to call on some names. I hope you don't mind. Okay.
Pain is unpleasant sensation.
Okay, pain is always unpleasant. Okay, it is two things that you brought in what you said. One thing that you said is it is unpleasant. The other thing that you mentioned is it is a sensation. Okay, those are two important things. Okay, let's build on further. Anyone else? What do you think pain is? Sudan?
Yes.
What is pain according to you? Okay. Okay. No problem. What is the word that we use in Tamil for pain? Vedana, right? Vedana அல்ல. வேதனைன்னு கேட்கும்போது உங்களுக்கு என்ன தோணுது? I speak Tamil Nadu Tamil. I know that it is very different from the Tamil that you speak in Sri Lanka. Sri Lankan Tamil is more pure. That is Tamil Nadu's Tamil has lost its purity, I feel. I've heard Sri Lankan Tamil. So வேதனைன்னு சொல்லும்போது உங்களுக்கு என்ன தோணுது? Anyone else? குழந்தை?
துன்பமாக இருத்தல், அவர் துன்பத்தை உணர்ந்து கொள்ளுதல், வேதனையாக இருக்கிறது, துன்பமாக இருக்கிறது.
ஓகே ஓகே, வெரி குட் வெரி குட். ஓகே, குழந்தை சொல்றாங்க வேதனையும் துன்பம். ஓகே, சம்திங் க்ளோஸ் டு வாட் கமலவேணி செட், அன்பிளசன்ட், துன்பம். ஓகே 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 ஓகே. Does anyone know okay, uncomfortable feeling. Okay, very good. So then, okay, it is always uncomfortable. It is never, when there is pain, we never feel comfortable when we have pain. And we never feel pleasant when we have pain. நமக்கு வேதனை வரும்போது நமக்கு இன்பம் இருக்காது. நமக்கு வேதனை வரும்போது அது துன்பத்தை உண்டு பண்ணும் மோஸ்ட்லி. Very good. Okay, anyone else wants to add some more?
It is the emotional one.
Okay, very good. Okay, very good. வேதனைன்னு சொல்றது இட் இஸ் நாட் ஜஸ்ட் பிசிக்கல். அதாவது நம்மளோட சரீர ரீதியாக மாத்திரம் நம்மளு உணர்ந்து கொள்ளுகிறது மாத்திரம் அல்ல, நம்மளுடைய இமோஷனல் ரீதியாயும் இட் அஃபெக்ட்ஸ் அவர் இமோஷன். when we have pain, it triggers an emotional response. It triggers an emotional response. When people have pain, mostly they are sad. Okay, when people are in pain, they are irritated. Irritation இருக்கும். When people who are in pain, when you see them, they may be angry. They may be frustrated. Okay, so pain always triggers an emotional response. There is no pain without an emotion. Pain will always have an emotional component to it. Okay, anything else that you want to share? வேற ஏதாவது சொல்ல விரும்புறீங்களா? செந்தூரன், லக்ஷிகா, கேரலின். Okay, let's move forward. Okay. உங்களுக்கு வேதனை வரும்போது when you feel pain, how do you describe it? எப்படி அதை வெளியே சொல்லுவீங்க?
Normally can you have pain.
நார்மலி வேதனை இருக்குன்னு சொல்லுவீங்க, வலி இருக்குன்னு சொல்லுவீங்க. ஓகே ஓகே, வேற ஏதாவது விதமா சொல்லுவீங்களா?
facial expression.
Expression. Tamil.
ஓகே 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 ஓகே, தாங்க முடியலன்னு சொல்லுவோம், டாலரேட் பண்ண முடியல. சிலர் வேதனை வரும்போது அவங்களோட பாடி லாங்குவேஜ் மாறும், ஒரு எக்ஸ்பிரஷன் இருக்கும். தட்ஸ் குட். ஓகே, anyone else?
Facial expression.
Okay, there will be a facial expression. That is good. Okay, that is how we express it. Then there is one name, I don't know how to pronounce it. Tuarahan, correct? Tuarahan. Okay. 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 What do you think? How do you describe pain, Tuarahan?
ஃபேஷியல் எக்ஸ்பிரஷன்ஸால எக்ஸ்பிரஸ் பண்ணலாம்.
ஓகே,
அப்படி இல்லைன்னு சொன்னா அது crying.
Okay, okay, there are many ways people express through their face. People express it as cry, people express it as frustration. Some people just keep quiet when they are in pain. அல்ல, எல்லாரும் ஒரே விதமா வேதனையா வெளிக்கொண்டு வர மாட்டாங்க. சிலர் ரொம்ப அமைதியா இருப்பாங்க, சிலர் கோவப்படுவாங்க, சிலர் தனியா இருக்க விரும்புவாங்க, சிலர் ஒரு கம்ஃபர்டபுளான பொசிஷனுக்கு வருவாங்க. So people, you know, employ different ways to describe pain. Okay, okay, okay. When, like, especially in palliative care, when you speak about pain, there are certain important things that you have to keep in mind. Certain important things you have to keep in mind when you say pain, because pain is a very common symptom in palliative care. More than 75% of the patients with advanced cancer will have pain. So pain is going to be one of the most common thing that you will see if you are working in a palliative care setup or if you are dealing with cancer patients. Okay. Always keep in mind, pain is a subjective experience. This is something that nobody said when I asked you to describe about pain. Subjective experience is on what is a subjective experience? Pain is a subjective experience.
Subject உள்ளார்ந்த உணர்வா இருக்கும்னு நினைக்கிறேன்.
Okay, உள்ளார்ந்த உணர்வு. Okay, okay, okay. Is there anyone else who wants to explain more on that subjective experience?
பெயின் யாருக்கு இருக்கோ அவர் தான் அதை எக்ஸ்பிரஸ் பண்ண முடியும், அவருக்கு தான் உண்மையா அதை எக்ஸ்பீரியன்ஸ் இருக்கு.
Okay, very good, very good. This is much closer. Okay, ஒருத்தருக்கு யாருக்கு வேதனை இருக்கோ அவங்க அதோட வேதனையோட முழு விவரமும் முழு தாக்கமும் மனசிலாகும், அது தெரியும். மற்ற யாருக்கும் அந்த have you heard this expression? என்னோட வேதனை உனக்கு தெரியாது, என்னோட வேதனை உனக்கு புரியாது, என்னோட வேதனை எனக்கு மாத்திரம்தான் தெரியும். Only I can know my pain. Only you can never understand how painful it is for me. You can never know. கேட்டிருக்கீங்களா அது?
Yes.
Yes. Okay, okay. Pain is a subjective experience. Only a person who has the pain knows the full extent of that pain. Nobody else can understand the full extent of the pain other than the person experiencing it. Okay, நம்மளுக்கு தெரியறது அவங்க அழுகுறாங்க, அவங்க கஷ்டமா இருக்காங்க, துக்கப்படுறாங்க, வியாகுலப்படுறாங்க, இதெல்லாம் நம்மள பார்க்க முடியும். ஆனா நமக்கு அந்த வேதனைய ஃபீல் பண்ண முடியாது. We can only see. Okay, we can only see how it affects that person, but we can never understand the true extent of them that feeling that pain. So it is a highly subjective. When it is very important when we say it is subjective experience, because clinically the way we approach pain is very different in palliative care. Clinically, the way we approach pain is very different in palliative care because pain is very subjective. Okay. Rendavathu, pain is perceived. What is the meaning when I say pain is perceived? Perceived na sonna enna? What is perceived meaning யாராவது சொல்றீங்களா? Carolyn?
Is become awareness or something consciousness.
Okay, awareness. Okay, awareness is very synonymous with perception. Okay, that is very good. What is your name? Tanujanan. Okay, am I right? Am I pronouncing it correctly?
Yes,
Tanujanan.
Yes.
Okay, thank you. Okay, so when we say it is perceived, it is felt. That is when we call it perceived. See, when we say somebody is perceiving something that we can see, something that we can hear, something that we can perceive by touch, understand, experience by touch. So that is what we call as perceived. Pain is also like that. We can fully experience it. One another thing when we say it is perceived is when something is perceived, it can be manipulated or it can be changed. Have you heard of disorders of perception? Disorders of perception கேட்டிருக்கீங்களா? There are two disorders, common two disorders of perception. என்னது? Hallucination, illusion கேட்டிருக்கீங்களா? Hallucination and illusion. Okay, these are two disorders of perception. Okay, so why do I say pain is perceived? It differs between person to person. For example, see, in your nursing practice, okay, you would have noticed that some people make a big fuss for an injection. They scream, they shout, they create a big ruckus when you go and give them injection. And some people don't show any response. You go and tell that I need to give you an injection. This is a very small, they don't bother. They just pull up their sleeves, show their hand and you pick them and they show no response. And some people cry. Okay, I have a video in my laptop where my brother is crying so much for a blood test. He was 27 years old when that video was recorded. Okay, some people create a big problem. Some people cannot tolerate pain. Other people have a big tolerance to pain. So the way people perceive pain differs from one person to another person. And the way we perceive pain is different at different circumstances. நமக்கு புரியிற வேதனை, நம்ம எக்ஸ்பீரியன்ஸ் பண்ற வேதனை டிஃப்ரெண்ட், வேற சமயத்துல வேறமா இருக்கும். ஃபார் எக்ஸாம்பிள், see, you have to go for your duty. நீங்க உங்க நர்சிங் டியூட்டிக்கு போகணும். You are already late. You have to catch a bus. And you see the bus coming near the stop and you are just coming out of your home. When you are coming out of your home, you hit your hand against the door, but the bus is waiting. The bus is waiting for you, but you hit your hand against the door and it pains, but you don't give any attention to that. All your aim is in catching that bus and going and joining the duty on time. Probably after getting into the bus, you will see where you have hit. You check your hand, ஏதாவது காயம் பட்டிருக்கான்னு எல்லாம் பார்ப்போம். But till then, we never bother. Till then, we never bother. The same thing in the middle of the night, தூக்கம் இல்லை, உறக்கம் இல்லை, and you go to the kitchen, தண்ணி வேணும், go to the kitchen, and on the way to the kitchen, you hit your hand against the door. And there it creates a pain. Have you noticed that there is a difference between the pain that you feel in the night and the pain that you feel when you're in a hurry? Have you noticed this difference? that we don't react to the painful stimulus, same painful stimulus, the same way in different the same way. It differs in different circumstances. அதை நீங்க பார்த்திருக்கீங்களா, notice பண்ணிருக்கீங்களா? When we are doing something, when our attention is somewhere, we don't give a lot of importance to a painful stimulus. When we are in a hurry, the painful stimulus is not so intense for us. But when we don't have anything to do, when our sleep is disturbed, when we are bored, even a small painful stimulus intensity is felt very different. நான் இப்ப சொன்னது மனசுல புரிஞ்சுச்சா? Did I make sense? Tanujanan, did I make sense? Or is it confusing?
Yeah, now I am in call. Yeah, I called. The patients called me.
Okay. Have you understood this difference? The way you feel the pain is different at different circumstances?
Yes, sir.
Yes.
Okay. So this happens even to us. Okay, it is not just a different person. For even to us, the way we feel pain is different in different circumstances. That is why it is very important to understand that the pain is actually perceived. It is experienced through multiple stimulus. So when the stimulus changes, the way we perceive pain is also very different. Okay. This is one of the common definitions that we use to describe pain. This definition is by IASP, where they describe pain as unpleasant. We all said this initially. Pain is an unpleasant sensation. Nobody enjoys pain. யாருமே வேதனை ஒரு இன்பமான காரியம்னு சொல்றது கிடையாது. வேதனை எப்பவுமே ஒரு usually துன்பமான காரியம். It is an unpleasant sensation. It is not just a physical sensation, it has an emotional component to it. நமக்கு வேதனை வரும்போது அது நம்மளுடைய இமோஷனை அஃபெக்ட் பண்ணும். நம்ம துக்கமாவோம், நம்ம கோவப்படுவோம், நம்ம எரிச்சல் படுவோம். So it affects. But வேதனை வந்து, the definition also says it is always associated with a tissue injury. வேதனை எப்போ வரும்னா நமக்கு ஒரு tissue injury உண்டாகும்போது வரும். Tissue injury நீங்க சொல்றாங்க, ஒன்னு actual tissue injury, the other one is potential tissue injury. அதாவது நான் கீழே விழுகிறேன், அப்ப எனக்கு ஒரு காயம் பட்டுருச்சு, I have an injury. அந்த இன்ஜுரி ஒரு வேதனை உண்டாக்குது. That injury causes pain. But sometimes even without injury there may be pain. For example, நான் என்ன இங்க அடிக்கிறேன் இப்படி, I am hitting myself here like this. But when I do that, there is no injury. அல்ல, ஒரு காயம் இல்ல, பட் எனக்கு வேதனை இருக்கு. The reason is because this impact can cause injury. The impact which can cause injury also can create pain. And that is what this definition says. This is just a definition, but most important thing that we have to keep in mind is this is a definition by one of the eminent palliative care physicians called Robert Wycross. அவங்க என்ன சொன்னாங்கன்னா, pain is what the patient says hurts. அதாவது வேதனைன்னு சொல்றது ஒரு பேஷண்ட் அவருக்கு என்ன வேதனை உண்டு பண்ணுதுன்னு சொல்றாங்களோ, அவருக்கு வேதனை இருக்குன்னு சொல்றாங்களோ, அதுதான் வேதனை. Pain is what the person says hurts. இது this is a very important definition. When you see pain as what the patient says, we actually value it. We actually give importance to it and we accept it. So this is the definition that we usually use in palliative care. Pain is what the patient says hurts. Okay. I earlier said pain is perceived. அல்ல, நான் சொன்னேன் வேதனை நம்ம ஃபீல் பண்ண முடியும், நம்ம எக்ஸ்பீரியன்ஸ் பண்ண முடியும், நம்மள உணர முடியும். The way we feel pain can be increased and can be decreased. சில காரியங்கள் வேதனையை கூட்டும், சில காரியங்கள் வேதனையை குறைக்கும். ஃபார் எக்ஸாம்பிள், ஒரு பேஷண்ட் இருக்காங்க, அவங்களுக்கு நம்ம ஊசி போட போகிறோம், we are going to give them an injection. அவங்களுக்கு ஏற்கனவே இன்ஜெக்ஷன் மேல ரொம்ப பயம் இருக்கு. that patient is likely to feel pain more than a patient who is not scared. நமக்கு ஏற்கனவே தலைவலி இருக்குது, தலைவேதனை இருக்கு. I don't know how many of you have migraine. Does anyone have migraine problem in this group? Migraine பிரச்சனை இருக்குதுங்களா யாருக்காவது? I have migraine. Okay, I take a lot of time. Okay. See, when you have migraine and you are bored, okay, செய்யறதுக்கு ஒண்ணுமே கிடையாது, and you also have migraine, the way your attention is always on that pain, and it constantly reminds us that we have pain and we are disturbed. But you have migraine and you are engaging yourself with something. You have something to do. You may not really feel the full intensity of the pain. நமக்கு வேதனை உண்டாகும்போது, and you are also, see, you have pain and you are also not sitting in a comfortable position. For example, you can take same migraine. You are traveling and you have migraine and you have not gotten a seat to sit down. That actually disturbs you a lot. And after some time, somebody gets up and you got a seat to sit. You actually feel the pain does not disappear, but you actually feel relieved because your discomfort has come down. So that actually contributes to the way you feel the pain differently. You feel the intensity of the pain decreases. You have pain. நமக்கு வேதனை இருக்கும்போது நம்ம தூங்கலாம். When you don't sleep, the intensity of the pain increases. நமக்கு வேதனை இருக்கும்போது நம்ம நல்லா உறங்கினா, if you sleep well, the intensity of the pain decreases. நமக்கு வேதனை இருக்கும்போது we are alone. நமக்கு நம்ம கூட பேசுறதுக்கு யாரும் இல்ல. We are alone. This usually happens in patients who have malignancy and fungating wounds. They have pain and they are left alone. That adds to their pain. When they are alone, they don't have anything to think about. They don't have anything to do about. So what they will do, they will think about their cancer, and they will think about their pain. So the more and more attention goes to their debility, disease, and pain, and that actually increases the way they perceive pain and their pain intensity. Their attention is given to that pain. So the way they feel the pain, they feel the full extent of their pain. But a person has cancer, but he has a very good support. There is a wife who is always with him. There is a wife who always tells him, I am always with you. I will never leave you. That companionship actually gives them a strength to face things, and their pain intensity comes down. Or a psychological component, a strength is there. So the intensity of the pain that they perceive is less. So there are certain things in a person's life or in a patient's life that exacerbates the pain, and there are certain things that decreases the pain. So pain is never a separate entity. Pain is always influenced, decreased, and increased by things that are happening around. This is something that we all have to know. I will give you go through this. You will understand there are certain things that decreases the pain. There are certain things that increases the pain. Any questions till now? ஏதாவது கேள்விகள் இருக்குதா? Sudan, you have any questions?
No.
Okay. I'm sorry, I keep calling the same names because you're the only ones you have kept your video on. I don't know if others are even there. Okay, yeah. Okay. Next, this is very important aspect when we speak about pain. Whatever we saw is about pain in general, but in palliative care or in cancer care, what you will often see is not just pain. There is something called chronic pain. Is my audio clear?
Yes, Terry.
Okay. What is a chronic pain?
The pain is present more than 6 months.
Okay. You directly took the definition of chronic disease, which says any disease more than 6 months is a chronic disease. Okay, that's a good thinking. Okay. The definition of the word chronic. Okay, 6 months. Okay. Anyone else wants to attempt? What is a chronic pain? Okay. Chronic pain is something that is persistent, a pain that is persistent or recurrent and lasting more than 3 months. It is not 6 months. In when it comes to pain, it is actually 3 months. But this 3 months cutoff is very arbitrary. It is not a very standard cutoff. Okay. Something that clearly defines chronic pain is these two words. இங்க கொடுத்திருக்க ரெண்டு வார்த்தை தான் chronic painல ரொம்ப important. A pain that is persistent. எப்பவும் இருக்கும். ஒரு வேதனை எப்பவும் இருந்துச்சுன்னா that we call as chronic pain. Or the pain keeps coming back. It is recurrent. போகும் ஆனா திருப்பி 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 வந்துகிட்டே இருக்கும். ஒரு நாள்ல கொஞ்ச நேரம் வேதனை இல்லாம இருக்கும் பட் கொஞ்ச நேரம் கழிச்சு அந்த வேதனை திருப்பி வரும். That is what we call as recurrent. A pain that is persistent, that is recurrent, is what we call as chronic pain. For example, ஒரு கேன்சர் பேஷண்ட் இருக்காங்க. There is a cancer patient. Okay. For example, CA buccal mucosa. CA buccal mucosa இருக்கு. There is an ulcer because of the cancer. So because of this ulcer, there is a tissue damage. இந்த tissue damage இருக்குதுனால, okay, this patient will have pain. As long as this patient has this cancer, this pain is going to be there. And the cancer மாறினாதான் அந்த வேதனையும் மாறும். So this chronic pain is secondary to cancer. And as long as this cancer stays, this pain is going to be there. So this pain is going to be persistent for some time, at least until the treatment completely resolves the disease, there will be pain. So that is what we call persistent. The pain is persistent and it comes back again and again and again. Okay. When we deal with chronic pain, we have to keep in mind chronic pain severely affects the quality of life. ஒரு chronic pain உள்ள பேஷண்ட்டுக்கு சந்தோஷமாவே இருக்க முடியாது. சந்தோஷமா இருக்கிறது ரொம்ப கஷ்டமா இருக்கும். There will not be any satisfaction. ஒரு chronic pain இருக்கும்போது there will not be any satisfaction. I have a friend, okay. எனக்கும் இடைக்கிடையில மைக்ரைன் வரும், அந்த ஃப்ரெண்டுக்கும் இடைக்கிடைக்கு மைக்ரைன் வரும். And whenever I get migraine, I will immediately take tablet because I don't want to experience that pain. So I know some triggers. எனக்கு migraine வரப்போகுதுன்னு சில triggers இருக்கு. So when I know the triggers are coming, I will immediately take the tablet so that migraine does not get worse. But this person will never take any tablet. Okay, this person is a medical professional but will not take any tablet. Will go through that migraine and after at the night that person will sleep and the next day it will all be all right. But throughout the day the migraine will be there and this person will go on tolerating that pain and then will go to sleep and the next day starts and after some time the migraine will come. This goes on and on. I asked this person, has anyone told you that you are very impatient? நீங்க ரொம்ப கோபக்காரர்னு யாராவது சொல்லியிருக்காங்களா? நீங்க ரொம்ப சமாதானமா இல்லாதது யாராவது சொல்லியிருக்காங்க? This person said, my spouse, என்னோட கணவர் எப்பவுமே அது சொல்லுவாங்க, நான் ரொம்ப கோபப்படுறேன், நான் ரொம்ப இரிட்டபிளா இருக்கேன். என்னோட ஃப்ரெண்ட்ஸ் சொல்லுவாங்க, I have a short fuse. Short fuse means, you understand, பட்டுன்னு அவங்களுக்கு கோபம். You understand the reason. This person who is going through that pain cannot hold the anger. It affects that person emotionally. They cannot be actually happy. Happiness is like they will be always sad, they will be always gloomy because they have pain. So chronic pain severely affects the quality of life. They will not be able to enjoy anything. It will all be sad and gloomy. சாப்பிட தோணாது, தூக்கம் வராது. So the chronic pain severely affects the quality of life and severely affects the mood of the person. Sometimes they may be sad, sometimes they are irritated. When the pain increases, they are frustrated. Treatment eduthu sariyagala, they will not cooperate. Many times when we go for home care, the patient's family will say, the patient is very irritable. He is not cooperating with anything. Already he is having cancer, but he is not willing to eat anything. He is always sad. He is not speaking much. So this always happens. Chronic pain severely affects the mood. Okay. And because of that, it is not just the patient who suffers, it is also the family who suffers. Okay. One of the very important things that we should keep in mind is that patient who has chronic pain does not actually appear to be in pain. அவங்களை நீங்க பார்த்தீங்கன்னா அவங்களுக்கு வேதனை இருக்கிற மாதிரியே தெரியாது. This is something that we have to always keep in mind when, especially when you deal with cancer pain. நம்ம யோசிப்போம் ஒரு கேன்சர் பெயின் வரும்போது ஐயோ பேஷண்ட் பயங்கரமா கத்துவாங்க, பயங்கரமா அழுவாங்க, பயங்கரமா ரொம்ப சத்தம் போடுவாங்க. That happens only in very small portion of patients when there is an exacerbation. அந்த கேன்சர் பெயின் திடீர்னு கூடும்போது தான் அந்த அழுகிறது, கத்துறது, சத்தம் போடுறது வரும். But most cancer patient, if you see, they will be quiet. ரொம்ப அமைதியா இருப்பாங்க, அதிகமா பேச மாட்டாங்க. They will be very quiet. If you ask something, நம்ம ஏதாவது கேட்டோம்னா அவங்க ஒரு வார்த்தை இல்ல 2 வார்த்தையில பதில் சொல்லுவாங்க. They will speak only very few words. In such patient, you should explore more, because when there is a chronic pain, it severely affects them and they actually keep quiet. The way their body changes, there are a lot of changes that happens in a person who has chronic pain. And what are the changes that happens in a patient with chronic pain, we will see. Okay. This is the difference between acute pain and chronic pain. Okay. Acute pain is transient. கொஞ்ச நேரம் தான் இருக்கும். நான் கீழே விழுந்தேன், எனக்கு ஒரு கையில அடிபட்டுருச்சு, காயம் ஆறுற வரைக்கும் தான் இருக்கும். அந்த காயம் ஆறிடுச்சுன்னா அந்த வேதனை மாறிடும். எனக்கு அப்பெண்டிசைட்டிஸ் வந்துச்சு, சர்ஜரி பண்ணாங்க, அதுக்கப்புறம் அந்த வேதனை போயிருச்சு. சர்ஜரி ஸ்கார் ஹீல் ஆயிருச்சு, அதுக்கப்புறம் அந்த வேதனை மாறிடுச்சு. So that is what is acute pain. Acute pain, that when that illness stops, acute pain also stops. Sometimes even before the illness, the acute pain stops. But chronic pain is not like that. Consider cancer. Cancer is a chronic disease. So as long as the patient has cancer, there will be pain. எப்போ கேன்சர் மாறுதோ அப்பதான் அந்த வேதனையே மாறும். So if you don't treat pain, நான் சொன்னேன்ல முன்னாடி சொன்னபோது ஒரு பேஷண்ட்டுக்கு கார்சினோமா பக்கல் மியூகோசா இருக்கு. So till you remove that cancer, the pain is going to be there. So the pain is going to be persistent and pain is going to be unremitting. Unremitting சொன்னா நம்ம ட்ரீட்மெண்ட் கொடுக்குற வரைக்கும் அந்த வேதனை மாறாது. And the pain is going to be recurrent until there is a major change in their diagnosis. Okay. So acute pain is a symptom. Okay. When you have an acute pain, okay, I have an injury, and my pain shows me that I have an injury. I have pain in appendicitis and the area lower abdominal எனக்கு வேதனை இருக்கு, that shows me that my appendix is inflamed. So it is a symptom. But sometimes cancer pain can become a disease in itself. சில கேன்சர் பேஷண்ட்ஸ்க்கு கேன்சர் கியூர் ஆனாலும் அந்த வேதனை இருக்கும், because the damage is already done and that pain continues. And in a patient with cancer, the pain itself becomes a big problem that requires a separate management. That is what we will see in the next class. How do we manage chronic pain? So it becomes a disease in itself which requires a separate attention. Okay. So in acute pain, it tells you that something is wrong. But in chronic pain, you know what is wrong, but the pain continues. So it actually serves no useful purpose. நமக்கு என்ன ஒரு பேஷண்ட்டுக்கு கேன்சர் பேஷண்ட்டுக்கு வேதனை இருக்கும்போது நமக்கு என்ன பிரச்சனைன்னு தெரியும், பட் தெரிஞ்சும் வேதனை கண்டினியூ ஆகும் unless you treat that pain. So that is one very big drawback or one of the difficult things. When a cancer patient suffers, we know what is wrong, but sometimes we feel very helpless. Another thing about one major difference between acute pain and chronic pain is autonomic concomitants are present